This is Dennis Shields, the Chancellor at the University of Wisconsin-Platteville, and welcome to the weekly update for October 30th, 2020. We're in front of Royce Hall now, where Student Health Services is located. Let's go inside.
I'm going to take your temperature. If you just stick that on your jacket somewhere, and then you may head upstairs.
Thank you.
Thank you.
So last Friday, Dr. Deborah Burks came and spoke directly to all of the chancellors and the president of the system. And there was good news and bad news. The good news was that she was holding up the system and its universities as exemplars for how you limit the spread of the virus. The bad news is that there's been a tremendous uptick in the state of Wisconsin. She thinks the University of Wisconsin system schools are part of the solution. It was very sobering to see someone like Dr. Burks, who's been in the midst of this, whose career has been in epidemiology, show the amount of concern she said about the trend in Wisconsin and the upper Midwest. The challenge, as she articulated it, is young people age 18 to 30 who are asymptomatic who spread the virus. And the way to control that is the way the university system has done it and the way we've done it here in Platteville. And that's by testing significant numbers of asymptomatic people so that we're aware of who's infected, we can isolate them and prevent the spread. This week we had a couple of days where there were over 300 people tested. And it's real important because the way you track and trace and limit the spread of the virus is by identifying the people who are asymptomatic that test positive. The testing is important because that identifies who the carriers are and allows you to isolate them so they don't spread it to others. The 18 to 30-year-olds are the ones that are asymptomatic because the virus doesn't seem to have as much impact on them immediately. The key is to identify those folks, get them isolated until they're not spreading, and hook up with all of their close contacts so that you can minimize the spread as quickly as possible. The impact the virus has had has touched me personally with folks that I know, both in Platteville and across my connections across the country. People here in Platteville have passed from the virus that I know of that have had a tremendously positive impact on the university, and now they're gone. And my supposition is that almost everyone on the campus, it's touched them somewhere. We want to limit that, and that's part of the commitment. You know, if you go back to last March when we first pivoted away, the central driving theme was to keep the campus safe. We've proceeded through this in a way with the advice of our student health director, Rachel Herman, who explained to me that we can't prevent the virus completely, but we can control it and manage the spread. And so that's been the focus. So everything we do, the testing, the tracking and tracing of students, we're now testing more staff. System is finding ways to provide more testing materials and staff to do testing. And as Dr. Burks said, she's encouraged the system to help the state do more tracking and tracing. So this is a statewide, community-wide effort to keep all of our folks safe and healthy. The effort and that this community, that the students, that the faculty and staff, that the city, that the Chamber of Commerce, everybody that is engaged in this is part of why I say every day is a great day to be a pioneer.